Hello and welcome to the Multicultural Media Online Forum here, hosted by the Ministry of Health, Multicultural Health Communication Service, and supported by Multicultural New South Wales. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service, your moderator for today and these sessions. And we're so glad again to have with us, of course, Dr. Jan Fizzell, our Senior Medical Advisor. How are you, Dr. Jan?
Well, thanks. Good afternoon.
Good afternoon, and it's great to have you here. We have, of course, before we start, we'd like to acknowledge the traditional owners of the land from which we are all meeting from today. We pay respects to elders past and present and emerging, and pay respects for us here to the Camaragal people of the Eora Nation. We also pay respects to multicultural communities represented in this forum today. So let's start. We'd like to also ask you, if you have any questions, please add them under the chat and we'll get them answered for you by Dr. Jan. We'll also be sending in some resources on links to resources for you so that you can use them with your publications or with your communities. Thank you. Dr. Jan, how are you today?
Well, thanks, Jess.
Any updates?
Yes. So COVID is still very, very much with us in our community and is still circulating along with influenza. So we have a number of respiratory viruses making people quite unwell at the moment. We have 1,355 people in hospital at the moment, including 42 in ICU, of whom 13 are ventilated and one is on the extracorporeal membrane oxygenation, so the heart-lung bypass machine. We have a large number of people who've had 2 doses, that's more than 95%, but we still have quite a few people who really do need to have their 3rd dose, as well as a number of people who should be having their 4th dose ready for winter. At the moment, only 64% of people who are eligible for having that 3rd dose have had it. Studies overseas have shown that if you do have that 3rd dose, your risk of hospitalisation and serious illness goes way down. So please, do take up that opportunity to stay up to date with your COVID-19 vaccination. And of course, people who are immunosuppressed, people over the age of 65 or have significant health conditions should be getting their winter booster dose. So even if they've had 3 doses up till now, they should be getting a winter booster dose to help keep them safe as we're coming through. We also have free flu vaccinations throughout the month of June. It's really important that we do encourage everyone 6 months and over to get those flu vaccinations. We are seeing young kids being hospitalised with flu every day, and some are winding up in intensive care. Those free flu vaccinations are an excellent way to help prevent that from happening. So please see your GP, see your pharmacist, talk to them about free flu vaccination.
Thank you so much, Dr. Jan. And there's a question about the flu vaccine. How many types of vaccine are there with the flu for the community?
So there's 2 major types of vaccine here in Australia. The first one is one for people over the age of 65, and it's called what they call an adjuvant in it. And an adjuvant is something that helps stimulate your immune system at the same time as you get the vaccine. And so people who are over the age of 65, their immune systems don't respond quite so well. That's why they need the winter booster with COVID, and that's why they've got this specially formulated vaccine. That's mainly available through GPs, but is also available through pharmacies. The rest of us have access to the standard produced flu vaccine, similar to what we've had for a number of years now, and it's available for kids and also available for adults in 2 different doses, depending on how old you are. If it's a little one's first time of getting the flu vaccine, they may need 2 doses of flu vaccine just because they have that primer and then they have the dose that's seals the deal, a little bit like with COVID when we need 2 doses, but adults only need a single dose of vaccine because they've probably met flu before in their lives.
Thank you so much. Now, local pharmacies, here's a question. Local pharmacies have been advising people over the age of 65 years old to go to their GPs for the flu shot available for this age group. Is this still the case?
Yeah, so some pharmacies may have that vaccine in stock, but others will mostly be in the GP surgeries. So yes, please do talk to your GP, talk to your pharmacy if you've got a really good rapport with your pharmacist, and they can tell you whether they stock it or not. If they don't stock it, then your GP is definitely the best bet, because that's one covered under the National Immunisation Program. So it's available to all older people throughout the flu season.
Thank you, Dr. Jan, we have some links on the chat for you. And for those media members who are online, please do ask your questions on the chat and we'll get them answered by Dr. Jan. There's a question here, Dr. Jan, about, there are clinics about New South Wales offering to help people with long COVID as well as flu. Are they available around and where should they go?
So COVID's a really interesting illness in that some people are still feeling unwell for a number of weeks afterwards, and some people are still feeling significantly unwell. The key thing is to go and talk to your GP. Your GP can also make sure that there's nothing else going on like thyroid issues or anemia, other things that can actually cause very similar symptoms to what's described as long COVID. So the first port of call, if you're concerned about how you're going after you've had COVID, is your GP, and they can refer you to the appropriate specialist depending on what they find.
And also, Dr. Jan, a reminder again for emergency departments, isn't it, that we present accordingly?
That's right. So one of the key things that people have probably seen in the media recently is the fact that our hospital system, our ambulances are incredibly busy at the moment. The first thing you can do is, if you're not sure whether you need to go to hospital or not, is you can ring the Health Direct 24/7 helpline. They are there to help you, and they will take you through a series of questions to see whether you don't need to see a doctor, whether you can see a doctor in the next few days, or whether you need very immediate care. So it's really important that we don't go straight to the hospital if we've got anything wrong with us. I know it can be really hard to get in to see a GP at the moment. There are also GP respiratory clinics around the state, and those GP respiratory clinics are willing to see people who have got coughs, colds, or kids with coughs and colds, because I know sometimes the GPs who have been doing an amazing job throughout the pandemic, but they do like to make sure that they keep their waiting rooms and their staff safe. So sometimes the GPs will see people, but only after a test. If you're concerned, those GP respiratory clinics are also available to help you. But it is really important that we do save the emergency department for those emergencies. And that way, if we're having a heart attack, if we've had an accident, the staff in those emergency departments are there to be able to treat those of us who really need that high acuity care. And the GPs, who are, as I say, they're amazing. They're a specialist in looking after you at the point of contact. They are doing such an amazing job throughout COVID, and really important that we save the emergency department for emergencies and get those specialists in our general care looking after us, and that's our general practitioners.
Thank you, Dr. Jan. A question about hypertension, and can fluctuating hypertension be the result of a recent COVID infection, or be a symptom of long COVID or side effect post having a dose of the COVID-19 vaccine? This is a question from the community.
So we haven't seen a lot of links between high blood pressure and COVID or COVID vaccine side effects. It's much more likely that the high blood pressure, the hypertension is being caused by something else going on in your body. So again, really worthwhile talking to your GP if you're having fluctuating blood pressure. It can even be things like timings of different medicines that you may be on. It may be to do with how much activity you have during a day. It can even, be due to whatever stresses you have going on in life. The key thing with blood pressure is to maintain a healthy diet, to keep your exercise regime up, but also to talk to your GP and just keep an eye on it, because if your blood pressure is too high for too long, it can do damage. And if it's super high, it can do immediate damage. So really important that you keep in touch with your GP about your blood pressure, but unlikely to be related to COVID vaccination or having had COVID.
Thank you, Dr. Jan. A follow-up to that question, someone had recently developed hypertension and booked for their fourth dose. Should they wait for their hypertension to settle before getting their fourth dose of the COVID vaccine?
No, really, unless you're particularly unwell with it, there's no reason to delay getting that fourth dose. And in fact, the fourth dose is really highly recommended if you've got other things going on. So no need to delay. If you're concerned, particularly if your blood pressure is very high, do go and see your GP and get that checked out, and then they can give you the fourth dose at the same time.
Thank you, Dr. Jan. The New South Wales Health website, this is a question here from the community that states that the flu shot is free, but it also states that some providers may charge an administrative or consultation fee. Can GPs that offer bulk billing charge an administration consultation fee for administering the flu shot?
Yeah, so GPs are private businesses like so many other private businesses, and Medicare is a rebate to the patient. So when a GP bulk bills, it's basically saying, I'm willing just to take your rebate from the government. So GPs are able to charge a fee for their service, and the key thing would be just to have that conversation when you book in. So if you're concerned there may be a fee, when you ring up to make the appointment or when you book the appointment online, just check to see if there's a fee. And if there's a fee that you're not happy with, choose somewhere else. But generally speaking, it's really important to understand that GPs are working really hard. It's been a very hard time for them. And so some of them may charge a fee because there are costs involved.
But they can also go to the pharmacy.
Also, absolutely. So there's also pharmacies available who are providing free flu right through to the 30th of June.
Thank you, Dr. Jan. Third questions were also, we've gone through this, we're testing for PCR and COVID-19 and PCR and also rapid antigen tests just to find out how we are. Are there any updates to how we proceed with testing and continue to have the rapid antigen test and PCRs?
So one of the things we're advising people who are at higher risk of having severe outcomes from COVID, so people over the age of 65, people who are immunosuppressed, people with very significant other illnesses, is if you do get the start of symptoms, do go and get the PCR test, because those PCR tests are more accurate than the rapid antigen test. And also there's an automatic linkage into New South Wales Health. You'll get a survey to talk to you about whether you've got symptoms, whether you're at high risk, whether you might benefit from treatment of COVID-19. So people with early symptoms of COVID-19 who are at very high risk of a severe illness are eligible for medicines, so tablets that can help prevent severe illness. So getting that PCR test can make that system a little bit quicker. If, however, you get a result from a PCR test and you haven't heard from New South Wales Health within about 12 hours, do call the number on the New South Wales Health helpline. You'll see a fact sheet in the chat about, what to do if you're at higher risk, so that you do have that link into getting those medicines prescribed for you. Rapid antigen tests are great if you're somewhere, for example, where the PCR testing isn't very readily available. If you're just checking yourself before you're going to a place like an aged care facility, or you're about to host a party with people who are older or who are medically vulnerable going, just to make sure you don't take COVID with you to either the facility or to the party. And even particularly if you've got a relative who's in aged care who may be leaving the aged care facility to come to a party, we've seen some examples, say after Mother's Day, where very kind families have taken their family member out to have a lovely time, and unfortunately the older person's taken COVID back with them. So if you can, before you have a gathering of family or friends, particularly around a person who's in aged care, please do make sure that you all do a rapid antigen test. They are getting cheaper and cheaper all the time. You can order them online. They'll be delivered to your door tomorrow. Really important intervention to try and stop COVID going with your relative into an aged care facility. Or, if you've got a family member who's had a transplant or any other immunosuppression, can really help protect that person.
Thank you so much, Dr. Jan. Current concerns within the community with flu now equals to COVID-19 appears to be driving an increase in mask wearing and social distancing behaviors. Any comments on this? This is good.
This is excellent. And I think this is what we'll be doing for the years to come, that we've learned a lot through what's worked so well for COVID. And whilst mask wearing was very common in some of our neighbouring countries, whenever somebody had symptoms or when it was the cold flu virus, we can now adopt that here. And it's really pleasing to see when we go out that other people are wearing masks, that are making those choices to protect themselves and protect others by wearing the masks. And again, we're really glad that a lot of people are working with each other and are being kind to each other, so that when somebody's not well enough to go out, it's just like, yeah, thanks, don't come with me. Before, I think most of us would have tried to cajole a family member or a friend, come along, it can't be that bad, you'll be right. The fact that we're now really sort of saying, no, if you're sick, that's great, you stay home, you get well, I'll go and have a good time anyway without you.
Thank you so much, Dr. Jan. But the reality is COVID is still around.
And that's the thing. Flu has never been a minor illness. Flu has always been potentially dangerous. And now we have COVID as well for the last 2 years. COVID is very definitely still with us. That's the equivalent of 2 hospitals worth of people with COVID in hospital in New South Wales at the moment. So it's not like it's a small thing. It's a really big impost on the healthcare system. It's a really big impost on people's health. And so that's why we're all trying so hard to do those little things that can actually help prevent COVID or flu. And so just a reminder, the little things include getting vaccinated, so making sure you're up to date with both your flu and COVID boosters, staying home if you're sick, as we've just talked about, wearing a mask if you're indoors in crowded places, and of course keeping the hand hygiene going, which is really easy to forget, but we do know that some people don't own tissues and they do tend to use their hands instead, and then they put their hands on surfaces that we're all touching, and it's quite easy for a virus that's been, you know, out of somebody's nose for you to accidentally pick it up and put it near your face. So if you can, try and remember to clean your hands before they go anywhere near your face, and just wash your hands before eating.
And it's easy to forget.
It's easy to forget, but I think one of the things is a lot of us got those tiny little bottles of sanitizer. It's time to just fill them up again and start using them again if we ever stopped, just so that we've got it easily available to us when we're, you know, getting on and off trains or wherever else we might be touching common surfaces.
Thanks, Dr. Jan. And this week is Men's Health Week, which is important to note. There are, you know, aside from COVID and all these other issues, if tackling men's health, how can we encourage men in our lives to speak about, you know, concerns of what's happening around us? There was, you know, flu and COVID, there's monkeypox that came out, and Legionnaire's disease stories and issues. What can we do to promote that within the men in our lives?
Look, I think it can be really difficult, particularly if you're a man from a culture where talking about your feelings, talking about how things are is actually incredibly uncomfortable, and it's actually quite difficult for those people to articulate feelings. So sometimes rather than telling someone not to be bottled up, what we really need to do is offer our support and care to them, to say that I'm here. If you want to talk, I'm here. But if you don't want to talk, I'm also here. I think that's really important. I think it's important that we look for changes in people's behaviour, so that if it's somebody who's unlikely to be talking about their feelings, or they feel it's unmanly to be talking about their feelings, sometimes rather than having them say, I'm feeling really tired, I'm feeling really down, what we look at is we see that, you know, they might not be taking interest in things that they previously took a lot of interest in. They may not be sleeping in their usual patterns. They may be sleeping more or having trouble sleeping, or they may be drinking more alcohol or using drugs in a way that's not healthy. So it's really important that if we see somebody that we care about and we see their change in behaviour, don't wait for them to unbottle. Talk to them that you're worried about them, and try and encourage them to see the GP.
Thank you, Dr. Jan. And what are the most common mental health issues faced by men at this time? And during this time, you know, 2.5 years has been a crazy time for everyone.
Yeah, and I think there are 3 major things that we're seeing. We're seeing a lot of people who've got anxiety, and it's appropriate anxiety when we're seeing, you know, we've had a pandemic, we've had, you know, changes to our standard of living, you know, query blackouts, lots of things that are making people feel really uncertain about how things are. And so it's not unusual for people to be feeling anxious at the time. People can also be feeling depressed. It's been a really challenging time, a lot of emotions and a lot of changes in people's lives that may not be things people like changes in their work, changes in their ability to be with friends, changes in their ability to travel and be with family. It's been a really challenging time for a lot of people. And so some people do have depression. And then, of course, we do have some people who've had some really terrible experiences in the last couple of years. We know that particularly in our linguistically and culturally diverse communities, COVID has been a really hard-hitting event, not just here in Australia, but also overseas. We tend to forget that some people have friends and family overseas. And whereas in Australia, for a lot of people, it's really unusual to know anybody who knew anybody who's passed away because of COVID. If you talk to people from the UK, if you talk to people from India, if you talk to people from the States, nearly everyone has had a family member or a close friend pass away from COVID. And so that all adds to the potential for post-traumatic stress disorder, particularly if people are feeling worried or sad or angry that they couldn't be with the people they cared about when they went through that particular thing. And then, of course, we've had floods, we've had bushfires, and we've still got people who are still getting over all the effects of the drought a few years ago, mice plagues. We can just keep on talking about it. So there's a lot going on for people's lives, but the key things are that there's lots of different ways to get help. There's lots of different ways to get help in different languages. It's really important that people do reach out for help. And even if you've got somebody who you can see is struggling and you're not quite sure how to help them, there's a lot of websites that will actually help you as a person who cares about somebody else work out how to have the conversation with that particular person. It can be, it can be as simple as asking, are you okay? But sometimes are you okay at the moment doesn't really cut the mustard, because I think most of us would say, no, I'm really not okay. But then it's, beyond that, it's not, are you okay? It's actually, how are you going? How are you coping? What are things like for you? And when you really are seeing a big behavioural change, it's just sort of saying, look, you just don't seem to be yourself. I'm concerned for you. And for blokes who wouldn't like to see a GP because mental health issues are not something I care about, these things can also impact our physical health really significantly. And so even if you can sort of say, look, you're not quite right, have you thought about going to see the doctor just to check to see if there's anything else going on? Sometimes that will actually help a bloke go and see a doctor when they might not otherwise.
Yeah, that's right. We have resources, and like you mentioned, Dr. Jan, there's resources on men's health on the Multicultural Health Communication Service website in different languages. And if you do need support in contacting services, you can call the TIS National Line 131450. Dr. Jan, you said about caring for carers. So a lot of them and the men in our lives are the ones caring and supporting families. It's very hard sometimes to ask, can I help you? When most of the time they're providing the help and support.
I think that's true. So a lot of men in our lives are currently carrying an enormous burden. They are caring for families. They're caring for kids who are having trouble getting back into the rhythm of school. They're caring about young adults who are very worried about everything from starting at uni, and they've been at uni when uni wasn't on campus, to jobs for young people. It's been a really hard time. And so I think it really is worth acknowledging the fact that it's been a hard time for so many of us, and that it's okay to be feeling flat. But the thing is, if that's starting to impact on your ability to, say, get out of bed and face the day, if it's impacting on your ability to take joy in the things that you would normally enjoy, if it's impacting on, eating and sleeping, that's when it's time to get in touch and start looking at seeing a doctor. And it may be that it's something physical that's changed in you. It could be that, starting a new exercise program, because one of the great things about exercise is that it can actually help with your endorphins. So once you've exercised with moderate intensity, you can actually wind up with that endorphin rush, which is really pleasant. And so that's a good way of actually feeling better and trying to get into a routine again. A lot of us had really good routines before COVID, and then COVID's come along and ripped it, either because we've had to work from home, we've had to be supervising kids more, we've had to be looking after older people more. There could be lots and lots of reasons why the routines we had pre-COVID have all been disrupted, and maybe finding a new groove is what will actually help put things back into balance, because I think it's easy to let things like exercise, it's easy to let things like self-care go when you're so focused on other people. So that ability to do that, but also the fact that there's a lot of carer support groups out there. So if you are a carer, getting in touch with the support group is really, really helpful. And also just to acknowledge the amazing work that a lot of our communities did during COVID with having telephone trees of support for each other, and maybe reaching out to some of the people that were part of those sorts of things to see if, you know, they're still willing to chat with you now that the crisis is over.
And Dr. Jan, being Men's Health Week, what are the 3 simple steps that we can advise or we can help the men in our lives or just the media for them to promote to their communities?
Look, I think the key thing is there's a really important thing about building a relationship with a doctor or a group of doctors that you trust, simply because men are less likely to go and see a doctor just for other things like, you know, problems with their period because they don't have them, problems with contraception, all of those sorts of things that women will come into doctors with from, you know, quite an early age, whereas men do not necessarily have that experience. So that ability to build up that rapport with a doctor is really important. And getting these booster vaccinations can be one of those chances to finally catch up with a doctor. Sometimes there won't be time, but other times there may be time. The other things are, of course, having a good routine. So making sure you're building into your week, time to exercise, time to eat well, because again, I think a lot of us during COVID, because either we couldn't go to the supermarket when we wanted to or couldn't do things, we built up some unhealthy eating habits. So trying to get back into a more healthy eating regime, and taking time to catch up with people again, because a lot of us have lost links with community during the pandemic, and really taking that time to build those relationships again. It's hard, particularly for a lot of people who are introverts. It's really hard to sort of get out of yourself and go and seek other people, but it's certainly worthwhile for our mental health.
And also, Dr. Jan, as many adults, it's hard to connect sometimes. It's very hard to reconnect.
Yeah, and especially if our community has been moving. So a lot of people will have lost a good part of their community who may have gone overseas 2 years ago and they haven't yet come back into Australia. And so trying to build new senses of community, whether that's through joining, you know, an organisation like the SES or the RFS, or there's lots of really amazing organisations that people can join. It could be a culturally specific organisation, or it could be something as I say, it could be Red Cross. There's lots of different ways of connecting with people, and I think some of those service organisations are a great way to connect with people. I know that they're always looking for volunteers, and whilst you already may be really, really, really tired, you know, just doing things like going to a community college and doing a course, you know, learning to do a painting, learning to do pottery, learning how to do things and just interacting with people again. And again, for those introverts who are not great at it, having something to do so you don't have to talk, but you can just get used to being around people again is probably a gentle way of getting back out there.
Dr. Jan, that's really great advice, and especially for Men's Health Week. And I guess this applies for everyone as well.
That's right. And you know, we'll all have different ways of coping. And we shouldn't assume that all women have got a great social network. Not everyone is, you know, as well connected. And so it's still important that everyone looks after each other in the weeks and months to come. I think we've all got a lot of adjustment to do. We're all still learning, which is something I keep talking about. Why does the advice change all the time? Because we're still learning. And so I think we'll still be learning about this and what's coming forth. But I think the thing we should be confident is that we have been able to look after each other. We've been able to be kind to each other. We've been able to make things work. And I think that's what we should keep working on, is that the positive things that have come out of the pandemic, making, you know, new friendships, new links, you know, and maintaining those now that we're coming out of COVID, making sure that the really positive things that have happened during COVID are not lost, that we keep building on those things. So if you had a good relationship with your next door neighbour during COVID, make sure that you keep putting time into that relationship so that, you know, as we move forward, we've got those social circles and those supports.
Thank you so much, Dr. Jan. And that's it for our New South Wales Multicultural Media Online Forum this week. It's Men's Health Week, as well as some information on COVID and flu. Thank you so much for joining us. Hope you join us again in the next fortnight. We'll have some topics for you, and also we'll make sure that this recording reaches you, and they're also available on the New South Wales Multicultural Health Communication Service website. Have a good afternoon. We hope to see you again next time. Take care and stay safe.